All right, for your Focus at 4 today, some scary studies coming out. A couple of recent studies showing that more women in Texas are dying after pregnancy. And here's the thing, experts really aren't quite sure why. The Texas Tribune reported today that one study shows that maternal deaths are on the rise nationally, but in Texas, they're increasing particularly quickly. In 2012, 148 women in Texas died within 6 weeks of the end of their pregnancies from pregnancy-related complications, including excessive bleeding, obesity, heart-related problems, and infection. 2 years earlier, that number was just 72. Joining us live via Skype is Dr. Dan Dawson, OBGYN over at CHI St. Joseph Health. Dr. Dawson is joining us over Skype instead of live in the studio because he is on call right now and he can't leave the hospital. So Dr. Dawson, thank you for being on call, and also thank you for joining us. Here's hoping no one goes into labor while we're here live on television.
Thanks. Yeah. We'll hope they it off a little bit.
Yes. Yeah. Give us 5 minutes here. And Dr. Dawson, when you hear these numbers that maternal deaths in Texas more than doubled between 2010 and 2012, what's your reaction? Anecdotally, what are you seeing?
Well, I think that there's several things that are involved. I think some of it may just be a statistical blip. I think may have to do with changes in our population. The Texas Tribune article mentioned this, and certainly one of the things that makes difficulty in controlling hemorrhage and hypertension in pregnancy, which are the leading causes of maternal death, is obesity. And so as our population becomes more obese, the number of high-risk pregnancies increase.
Sure. So those are some of the reasons that you think those might be on the rise. So this may seem basic to some folks, but let's remind people, what can women do to mitigate these issues, these blood pressure issues, before, during, and after pregnancy?
You know, the most important thing is to have good medical care. One of the other things that's always been a problem in Texas has been nutrition. Counties in Texas do not have an OB-GYN physician practicing there, and that's true today. So finding an OB-GYN physician to take care of you and being compliant about those visits during your pregnancy, about following the physician's guidelines and taking care of yourself both before delivery, in the immediate time after delivery, and then in that first 4 to 6 weeks after delivery is really key.
Interesting. Yeah, clearly that's a crucial time, as we're seeing from these studies. Parts of that study, interestingly enough, show that drug-related deaths and suicides were the second leading cause for these maternal deaths, about 11% of them. So how much of a problem is postpartum depression, or even just adjustment to maternal life? Is that part of the issue here?
Well, certainly, you know, I think adjustment is something that every mother of a newborn experiences, and adjustment alone doesn't lead to suicide. However, postpartum depression is a real issue. Mm-hmm. Physician practices should, in general, screen every patient during the postpartum period for postpartum depression, and that should be a routine part of the care in the postpartum period.
Sure. What can women and families do to help that issue? Just try to stay cognizant of the reality that it might exist?
Yeah, pay attention, provide a lot of support. Mm-hmm. Note that there's a difference between crying for a few days and then not being able to take care of yourself. Those are really different things. And when you have someone that's a mother of a newborn and she's behaving differently or bizarrely or not able to take care of herself, losing care of her own personal hygiene, that's something that should be brought to her attention and to her.
Right away. So statistically, you saw in the Tribune article, black women are most at risk of these maternal deaths, and that's being attributed in part to access to health care. So how do hospitals like CHI St. Joseph help every woman get the health care she needs, and even just the information she needs to stay healthy during pregnancy?
You know, hospitals like CHI St. Joseph's and other local partners like BBCAA, mm-hmm. and the OB-GYN physicians in this community, we work hard to make sure that we provide clinic access to all the patients, be the patients that have traditional insurance, those that have Medicaid, or those who have no insurance at all. One of the really important steps that we've taken here at CHI St. Joseph's to increase safety is the reason why I'm here at the hospital today. We have an OB hospitalist program, which makes sure that there's an OB-GYN on the unit 24/7, 360, care of 5, like hemorrhage and hypertension. So just like a trauma center has a trauma doctor present to take care of someone who comes in by ambulance from a car wreck or a home accident, we have the same thing for women in the period around their pregnancy.
And you are there proving that right now. It's why, once again, you are joining us over Skype from St. Joseph just down the road. It's because you can't leave the hospital. You got to be there in case something happens. Well, Dr. Dan Dawson, thank you so much for taking a few minutes out of your day and what you're doing to help shed a little light on this issue and these studies. The Texas Tribune even mentions the data is messy, and you say the same thing, but still, it gives us something to think about. Dr. Dan Dawson, thanks so much.